Hello, and thank you for joining our webinar today on qualitative research. I'm Polly Kerr, and I'm the Patient and Public Involvement Manager for the Oxford Biomedical Research Centre. And together with my colleagues Claire Murray from the Oxford Health Biomedical Research Centre, Claire Schwartz from the Applied Research Collaboration for Oxford and Thames Valley, and three of our public contributors, Hubert Allen, Kath Greehey and Julia Haber-Hunt, we are hosting these webinars for patients and members of the public who are involved with research or who are interested in getting involved. In a minute, I'll introduce our speaker for today, but just to say that we're recording the session and it'll be available on our websites afterwards. There'll be about 15 minutes for questions after the talk, so please do submit these throughout using the Q&A function. Questions go through a moderator, so you won't immediately see them appear, but they have been acknowledged. Just a reminder as well that these webinars are aimed at increasing patients' and public's knowledge and understanding of research, so the questions will be prioritised to reflect that. Finally, we'd love your feedback on the webinar, and we'll be pasting a link to a very short questionnaire in the chat at the end, so please do send us your thoughts. And now I'm really pleased to introduce our speaker for today. Dr Nikki Newhouse is a postdoctoral researcher in the Nuffield Department of Primary Care Health Sciences at the University of Oxford, where she works as a qualitative methodologist alongside a diverse multidisciplinary team drawn from the clinical trials, engineering, health psychology, human factors and medical communities. Nikki's primary research interest is in human-computer interaction, in particular the development, evaluation and implementation of complex digital interventions to support physical and psychological well-being across the lifespan. She uses qualitative and participatory design methods to explore how and why people use and don't use technology in the wild. In this presentation, Nikki will talk about what qualitative research is and isn't, and why it matters for healthcare. She'll use examples from her experience to illustrate how we might go about designing good qualitative studies with clear research questions, focusing on best practice in data collection, analysis and presentation. Nikki, thank you so much for speaking to us today. Over to you.
Thank you so much. Hi everyone. Thank you for the opportunity to talk to you about my favourite topic for the next 40 minutes or so. So yes, as well as being lucky enough to work on a really wide range of research projects with the team at the University of Oxford and beyond, I also have the privilege of spending quite a lot of my time teaching all things qualitative as part of the university's Centre for Evidence-Based Medicine educational programme. I co-coordinate the introductory qualitative research methods course, and I teach on the advanced qualitative course, the mixed methods course, and a number of other modules. So I hope I can bring some of that experience today to you today in this talk. Okay, so over the next 40 minutes or so, we are going to take a really quite practical look at the main principles of qualitative research. And by the end of this session, I hope that you will have a better idea of what qualitative research is and its role in particular in evidence-based healthcare. I'm going to introduce you to the idea of thinking qualitatively and why shifting your mindset really matters when it comes to engaging with qualitative research. We'll then go on a bit of a whistle-stop tour of qualitative research design, and we'll look at the ways we can use frameworks and checklists to evaluate whether or not qualitative work is actually any good. We'll finish off with the considerations, similarities and differences between qualitative research and PPI. Okay, so first of all, full disclosure here, this webinar is actually really difficult for me for the simple reason that I can't see you. I can't even see myself. A big part of talking about and teaching qualitative research involves a high degree of audience participation, and I might invite you all to, for example, provide me with your examples, which we could discuss as a group, or where I might answer questions as we go along, and that's obviously not particularly easy to do in an online context. So I'm going to try and sprinkle in a bit of audience participation as we go along, and we'll see if it works. So feel free to add reflections, questions or answers to the things I ask you using the webinar chat function. I can get back to you after the webinar if need be, and feel free to just answer me in your head or to scribble things down on a piece of paper. So I want to kick off the session by asking you what you think qualitative research is. In particular, I'd like you to think about how your professional role, your personal education experiences, how these might influence what you think about what qualitative research is. For example, what do you think doing qualitative research actually involves, and what do you think about using qualitative data as evidence in the context of healthcare? We're going to come back to this later in the session. So essentially, qualitative research differs from quantitative research in that it involves the collection and analysis of very different kinds of data. These are usually words and images which explore experiences, beliefs and attitudes, for example, rather than numbers or quantifiable instances of events. This rich data can help understand the context behind numbers. For example, why do some people not take their diabetes medications, or what has to be in place before GPs feel comfortable about offering their diabetic patients a mobile phone support tool. We don't just collect and report anecdotes and chats. As we'll see, qualitative research has its own systematic approaches to ensuring rigour and avoiding bias. It's important to understand from the outset that qualitative methodologies are not looking to describe the truth. Rather, we acknowledge that there are multiple ways to experience a singular event and that explaining this variation is really important. And this is why qualitative research focuses on transferability rather than large-scale generalisability. Crucially, and this is often a really challenging idea for people who are more familiar, should we say, with quantitative methods, qualitative researchers are the data collection tool. This means that we acknowledge from the start that we bring something to the process of data collection and interpretation, and we don't deny that or try to hide it. Subjectivity and what we call reflexivity about our own position in the research process are front and centre of the approach. Qualitative research is generally concerned with kind of peeping behind the curtain of people's lives in order to explain nuances of meaning so that we can get an in-depth understanding of an experience or a context. Qualitative research is typically inductive, which means that we don't go into our research to test a hypothesis or with a pre-existing idea of what we think we're going to find. Instead, we kind of begin with an intention to explore and we're guided by the data. The inductive approach is what allows us to generate evidence-based theory, explanations and hypotheses. We employ small and very strategically chosen samples to collect rich data, and we do this by taking a flexible and iterative approach which allows us to respond to what our participants are telling us and make adjustments to our research questions and methods if required. Analysis of our data allows us to describe an experience or set of attitudes, and sometimes we just stop there if that's what the research calls for. More usually, however, our analysis will move beyond this descriptive level and offer an interpretation and explanation of what we're researching, which is supported by new or existing theory. This active interpretation is hugely influenced by simply being people first and foremost rather than researchers. We bring our own experiences, our own biases and assumptions to the process, and thinking qualitatively means that we must acknowledge this from the outset. So why should we even bother using qualitative research? So we use qualitative research to understand people in their natural settings. Fair enough. This helps us to understand the lived experiences of difficult topics such as stigma, discrimination or loneliness. And it also helps us to understand behaviour when the relevant variables are not particularly obvious. For example, understanding why people don't take their diabetes medication even when they know that it's good for them to do so. I'm sure it won't be surprising to you if I suggest that using different methods to collect data will probably result in a collection of different kinds of data. All methods have their strengths and weaknesses, but let's take a look at the implications of organisations or policymakers relying solely on quantitative data such as surveys. This real-life example shows the responses provided by an elderly lady to questions about her experience of being treated on an acute elderly care ward. As you can see here, her response indicates that she felt that she was treated with respect, and she rated her overall care as being excellent. This next slide, however, shows an extract from a narrative interview with the same woman on the same topic, where she talks about the acute embarrassment and intense annoyance she experienced at not being provided with a bedpan, a situation that she believed to be predictable and avoidable. You can see that she says, "The other thing I didn't raise I should have done because it does annoy me intensely, the time you have to wait for a bedpan. It's because we need it now. I just said to one of them, I need a bedpan, please. And it was so long bringing it out, but it was too late. It's a very embarrassing subject, or they don't make anything of it. They just say, oh, well, it can't be helped if you're not well. And I thought, well, if only you'd brought the bedpan, you wouldn't have to strip the bed and I wouldn't be so embarrassed." I hope you'll agree that the implications arising from these different methods of capturing information couldn't be more different. The results from the survey wouldn't have led to any action. Indeed, the ward team would have been quite appropriately congratulated for the care they provided, whereas the interview revealed how upset the patient was as a result of an action during her treatment that had left a lasting and highly negative impression. It's really important to acknowledge that neither piece of evidence is more true than the other. the patient's overall care was excellent and she had a bad experience on the ward which could have been avoided. One does not cancel out the other. It's not exactly controversial to suggest that having a good clinical outcome is not the only variable of interest when you're a patient. However, it's only by asking patients to tell us about their experiences in some detail that we can understand what all of their care looks like and allows us to respond to any problems appropriately. Okay, so what does it mean to think qualitatively? Essentially, qualitative researchers start with the position that you and I, we all see the world through our own unique lenses. These might be political, social, cultural, and so on. In short, people can interpret the same thing in different ways depending on where they're looking from. Indeed, even within ourselves as individuals, there's a possibility of holding different, even contradictory views when we're in different contexts. Qualitative research based in the social sciences in particular is often grounded in an ontological position called critical realism. Essentially, this means that we hold the belief that we all construct our own realities to varying degrees. One way to think about this is to think about the qualitative paradigm on a sort of crude and slightly artificial continuum. At one end, we have positivist or realist approaches, which are common to quantitative research, in which we behave a little bit like archaeologists, digging away at a problem until the one singular capital T truth is found. We select an appropriate statistical tool for the job, and anyone holding this tool will find the same one truth. Realism has at its foundation the idea that reality exists regardless of beliefs and interpretation, and realists propose a direct relationship between what is observed and reality. Conversely, the relativist or constructionist view of qualitative research takes the view that we sculpt and co-construct our own truth, and even though much of what we sculpt shares certain similar characteristics, everyone's final idea of the truth will be slightly different and unique to their own interpretation. It's this interpretation and the implications of it in relation to the research question that the qualitative researcher tries to describe and explain. Thinking qualitatively means that we acknowledge that no single interpretation is more important or more real. In fact, people's perceptions help us to create bigger and better understandings of problem or context. So here are some examples of qualitative research questions. They're phrased as questions and they all share some component of wanting to know more about what a clearly defined group of people want, what that group of people think, or how these people would describe an experience. As we go along in this session, I'd like you to start to construct a research question, perhaps from your own experience or interests, something that might suit a qualitative approach. When we're thinking about qualitative research questions, however, we need to think carefully about what parameters might be important. We can't ask everyone everything, so we need to kind of think about how we might make our question quite specific and how we might remove ambiguity. We'll be coming back to this in a bit when we've had a look at how we go about actually doing some qualitative research. Okay, so in this next section, we're going to take a look at the processes of conducting quantitative research. It's important to acknowledge that conducting quantitative research well involves the use of a systematic approach, a transparent guiding framework that helps to demonstrate that we've moved from research question to data collection to data presentation. However, although this needs to be systematic, it's not a strictly linear process, particularly when it comes to analysis, and a flexible mindset iterative approach is really super important. Rather than being a process of one and done, data collection and analysis are extremely reflective, time-consuming, collaborative processes in which we sit and think, we discuss our thoughts with our peers and our colleagues, and we revisit the data multiple times. Sometimes people think that doing qualitative research is just about having informal chats with people. We do indeed spend quite a lot of our time talking with people, but in fact, qualitative research is actually made up of multiple methodological approaches, all with their own guiding epistemological principles, rationale, and appropriate methods. And so when we're designing qualitative research, it's important to consider whether our methodological approach fits our research question. While much of our qualitative research is inductive and data-driven, or takes what's called a bottom-up approach, there are variations in this, and the approaches can be placed along a continuum with observational methods such as ethnography at one end, and more structured approaches such as framework analysis at the other. Neither is more qualitative than the other, but they are different in that they're grounded in different guiding principles and they answer different kinds of research questions by employing different kinds of methods and analytical frameworks. I'm going to give you a brief overview of 3 of the most common methodologies, but before I do, I just want to underline the importance of acknowledging the difference between methodology and method. This is something that crops up a lot in our teaching. There's a really important distinction. So a method is simply a research tool, for example, in an interview or a focus group. But methodology, on the other hand, is the justification for using that particular method. So making sure that we're clear about our methodology stops us from just jumping into using a method we quite like the look of because it's a bit trendy or it seems a bit easy in other methods. And as I'll show you now, methodologies in qualitative research fit certain research questions and come with their own ways of doing research. So let's start with IPA. Interpretative phenomenological analysis, or IPA, is regarded by many as being as hard to do as it is to say. It was developed in 1996 by Jonathan Smith from London's Birkbeck University in response to the need for a qualitative approach that explored people's experiences and explained them using psychological principles. IPA is very much grounded in the key philosophical principles of ideography, phenomenology, and hermeneutics. This essentially means that IPA is concerned with trying to understand the lived experience of individuals and how participants themselves make sense of their experiences. Its central concern is the meanings which those experiences hold for the participants and what role the researcher's own interpretation plays in making sense of that data. The aim of IPA is not to develop theory. Rather, IPA researchers aim to provide rich and thick description of the phenomenon under exploration, and they do this by working with selected homogeneous samples around 3 to 10 participants over time. IPA researchers collect all the data, and each participant's data is analysed in full completely before moving on to the next one. Moving on to grounded theory. So grounded theory was developed by the sociologists Glaser and Strauss in the 1960s in a groundbreaking study exploring people's experiences of dying. The fundamental aim of grounded theory is to gain understanding of how a group of people define their reality through their social interactions and to develop theory as a result. This is achieved by moving beyond description of what we see in our data and can lead to the generation of hypotheses which can then be tested empirically. For this reason, it's often used in under-researched areas. It's a good way of generating evidence to support the prediction and explanation of behaviour once enough data has been collected and enough is known around the possible theoretical basis of what's happening. Some of the core principles around grounded theory relate to literature review, the process of data collection, and the analysis and the concept of saturation. Unlike most other methodologies, grounded theorists propose that the literature review is delayed so that any theoretical ideas that the researcher has are grounded in the data and are not swayed by having done a thorough review of the published evidence. This is obviously quite challenging with regard to persuading a funding or ethics body of the merits of your research proposal, and therefore the rationale for conducting only a very light touch review needs to be explained very well. The next core principle relates to the idea of theoretical sampling. This means that participants are initially selected to have experience of the phenomenon under exploration, but the recruitment process of often quite large groups of people is then continually revised throughout the data collection period. And it follows up sort of these theoretical ideas as they arise. This means that data analysis begins when data collection begins. This process is called constant comparison, and the reciprocal relationship of data collection and analysis continues until no more new insights arise. This is called data saturation, and we'll come back to the idea of data saturation in a bit when we talk about methods and analysis. Okay, so finally I'm going to talk about ethnography. Ethnography originates from early 20th century anthropology and involves the immersive observation of people, cultures and experiences. Ethnographers participate in people's everyday lives for an extended period of time, examining how what people do contrasts with what they say they do. Ethnographers specialise in becoming an insider while being an outsider, a position that's been called being a professional stranger. Data collection is relatively unstructured and interrogates what might be considered to be obvious and mundane to the community in question, but which might yield huge insights in terms of working practices or group dynamics, for example. Increasingly, an adapted form of ethnography is used in healthcare research called focused ethnography, which explores a specific problem within subcultures or among small groups of people. For example, it might be used to understand how a new digital tool is being used in situ by a nursing team. So before we move on to talking about the nuts and bolts of doing qualitative research, I want you to go back to the research question that you might have started thinking about earlier in the session. Very broadly, what methodological approach might you use to answer it? For example, are you interested in collecting deep data from a few people, or are you interested in watching people within a particular context? If you're working with qualitative research at the moment or on qualitative projects now, can you identify what methodology they're using? And what do you think about that now that perhaps you know a little bit more about some of the key differences between them? Okay, so rigor and avoidance of bias are just as important in qualitative research as in quantitative research. We've touched on the importance of a specific research question, which has the potential to answer a clearly defined problem. We've thought about the importance of making sure the methodology we've chosen fits our research question. But now we're going to look in particular about how you might decide who your participants should be and how you might recruit them. And we'll address some of the key misunderstandings and misconceptions which prevail around this and consider how they relate to rigor and quality in particular. So qualitative research is often accused of having small sample sizes, as if this is necessarily a bad thing. Yes, qualitative research often involves what might be considered to be small samples if we compare them to, say, the hundreds or even thousands involved in quantitative research. But why does it actually matter? First off, we're not looking for statistically robust representation of a population through our sampling. This is just not a primary aim of qualitative research. Remember that qualitative research is not interested in generalisability, but in sensitive transferability across contexts. Rather, sample size is considered in line with our methodological approach and is determined in order to answer our research question. So grounded theory studies might include up to 50 participants in the development of new theory, while an IPA study might focus on the experience of 10 people or even fewer. Rather than being a limitation, this flexibility in the way we approach sampling in qualitative research is actually one of its key strengths. Relatively small sample sizes means that we need to be extra rigorous in justifying why we're including these particular people in our sample and why we think these are the people who will help us to answer our research question. We can sample in a variety of ways, and we'll need to decide which is the most useful to help us answer our research question. So propositive or purposeful sampling is a common approach in which a set of inclusion and exclusion criteria are drawn up beforehand based on an explicit rationale. It's a good way of kind of kick-starting the research process in a way that's both systematic and yet allows for some flexibility as recruitment goes along. Theoretical sampling is common to grounded theories we've covered and involves taking an iterative approach in which data collection begins with people who fit certain inclusion criteria, but the sampling might then be adjusted as data collection continues because new or unexpected ideas start to emerge and are worthy of further exploration in order to support the development of this new emerging theory. Snowball sampling is the term applied to one participant leading you to another and is valuable, really valuable actually, in hard to reach populations or when you're exploring sensitive or perhaps even taboo topics. And finally, convenience sampling is perhaps the least rigorous approach. It's often seen, for example, in university departments where undergraduate students are invited to take part in research for credit, or when research teams simply interview people they know and have easy access to. If it's the only option open to you as a researcher, that's okay, but be really ready to justify it and justify why this is the case when you write up your data. So a common misconception around sample size relates to the idea of saturation. As you may recall, this term originates from grounded theory and means that you believe that your participants are no longer telling you anything new, that your data is saturated and therefore data collection is finished. This idea implies that only a very large sample size is sufficient to generate enough data to answer your research question. And this principle has been really challenged in recent years by Kirsty Malterod and colleagues, who instead invite us to think about information power and the idea that the more information held by your sample, the fewer of them you'll need to meet the aims of the research. In addition, they suggest that we pay attention to factors like the breadth of the study aim and the study question, the use of theory and the quality of the interview dialogue. This figure from their paper isn't a formula for determining the power of the sample, so to speak, but rather it's a really useful guide to support appropriate sampling. It invites us as researchers to really quite carefully reflect and critically think about where the balance lies in the specificity of our research question, our use of theory in developing and analysing our data set, and even our own skill set and competence as qualitative researchers. Let's move on now to thinking about how we might design a propositive sample. A variety of factors will help us to determine who we need to approach to get our research started, including existing academic evidence from literature review, our own personal and professional experience, and our overarching research question. If we're being good researchers, we will have an advisory PPI panel who can support us with thinking about who might be missing from our sample, or even who perhaps we shouldn't be including. Remember, this is about ensuring that we're thoughtfully and sensibly including people based on factors which we believe might provide the information we can use to answer our research question. This is absolutely about making sure that our choices are not biased or limited and are grounded in a very strong rationale. This is an example of a sampling frame that I'm currently using in a study exploring the implementation of a new digital tool to support remote monitoring of patients who've had a recent exacerbation of their COPD. You can see how a spread of factors beyond demographics were thought to be of potential relevance when it came to sampling the patients and answering the research question. These include where they live, how long it's been since they were diagnosed with COPD, whether they smoke, how they would rate their current health status, and also kind of the degree to which they've engaged with rehab and different types of COPD support. However, the sampling frame you can see for the healthcare team is much more simple because we simply just want to get the views of anyone involved in using the digital tool, who is using the digital tool with their patients, not their parents, their patients. So it's much more around just getting a reasonable and logical spread of people from within that healthcare team sample. Reflecting on Kirsty Maltrid's ideas around information power, this is anticipated to be a rich sample, and sample size was also guided, quite importantly, by the pragmatic reality that I'm collecting and analysing this data on my own as the only qualitative research on the project. One last note about sampling. If nothing else, please think about qualitative sampling in terms of quality rather than quantity. Is your sample likely to generate relevant and rich information? How will you work with other people who could support you being able to develop knowledge and understanding that's transferable to other similar settings, or which the reader will be able to apply and transfer to their own context? Is it reasonable to assume that data is accurate in the sense of being believable and recognisable to others working in the field? And is it ethical and feasible to work with the people that you want to work with? Okay, let's move on to recruitment. Just take a quick sip. So, you've determined a research question, you've thought about methodology, you've defined your sample and you're ready to recruit some participants. The first thing to note is that recruitment for research is rarely easy, and this is particularly true for qualitative research where participants might be asked to give up quite significant amounts of time and share sensitive information about themselves. Recruitment within healthcare settings, especially those involved in the NHS, can be really quite difficult. It can involve navigation of barriers including bureaucracy, paperwork, gatekeepers and questions around who gives consent. Think about interviews, for example, with very young or very old people, those receiving specialist care or those with some form of cognitive impairment. Recruitment is a highly interpersonal process, and your ability to sell your research and the potential value of your research to participants is key. When it comes to recruitment, it can be really tempting to approach those who we know will say yes, or who might be well behaved. When it comes to recruiting or evaluating existing recruitment methods, think about who is approaching participants and why this might matter. Are people being approached fairly? Are they able to provide real consent, or is someone in the room who might make it difficult for them to agree or disagree to take part? Who's included in your sample and who might be missing? Are you keeping an eye on this, and are you keeping records also around who's been approached, who might have said no, and why this might be the case? And think about whether or not your sampling strategy remains consistent with your methodological approach. If you're using guided theory, for example, are you analysing your data early and adjusting your sampling as you go along? At this point in the session, you might want to return to your research question and think about what kind of sampling strategy suits your question circumstances. How might you go about developing a basic sampling framework which is clear enough for someone else to understand and put to use? How might you recruit and tell people about your study? Who should be doing this and who shouldn't be doing this? So finally, I hear you cry, we're ready to collect some data, but what data will you collect and how? Interviews are perhaps the most commonly used method of data collection in qualitative research. Their sole aim is to explore the participant's experience from their perspective, and it's important to consider what we think we're going to get out of an interview. It's helpful, I think, to think of interviews as being an interview, as represented here by this vase illusion, Rubin's vase illusion. This means that there are two people participating in a dialogue and they're interacting and therefore creating shared knowledge, represented here by the vase in the middle of the illusion. There are three commonly used types of interview. So structured interviews involve asking the same questions in the same order for all participants. It's intentionally inflexible and very much like a quantitative questionnaire. The interview does not take advantage of the dialogue inherent in more natural conversational interactions. Semi-structured interviews are the most commonly used interview approach, in which dialogue is guided by predefined questions but stays flexible and that it allows participants to lead the way. The third type of interview is unstructured. This means that although the researcher has a clear sense of purpose, there's no guide. These interviews usually involve the researcher asking one big opening question and then remaining a listener as the participant responds. These interviews are commonly used when we're interested only in the most significant experiences in someone's life story. So interviews can be conducted in a variety of ways, and indeed we've really had to adjust to the pandemic in recent months. So face-to-face interviews are most common and are often optimal. For example, being together physically facilitates quicker rapport between the participant and interviewer, and you do have access to non-verbal cues. However, they can be logistically challenging and are not actually always the best option, particularly when it comes to, say, working with busy healthcare teams. Telephone interviews are undeniably quicker to conduct, and they can be much more suitable for less sensitive topics when you're working with certain groups of people. But as a researcher, you miss out on non-verbal cues and the importance of narrative devices like silence and allowing participants to have a gap in the conversation to reflect and think. They feel really different on the phone when compared to being face-to-face. Thirdly, email interviews are useful in that they do allow participants to take their time before responding, and they also allow us as researchers to conduct several interviews at the same time. And it's great that transcription is done immediately, but there is this fundamental loss of interaction between participants and interviewer, which might impact on the quality of the data that we gather. When it comes to asking questions, we want to make sure that we're framing our interview by including introductory, transition and cooling down questions. These support the participant in knowing where they are in the interview and just generally smoothing the process. An introductory question might be something like, can you please start by telling me your story from the point where you suspect something was wrong? A transition question might be something like, up to now we've been talking about the impact of your illness on your relationship with your family. Can you please tell me now about how it affected your work life? A cooling down question is used to signify the interview is coming to a close and allows the participant to summarise what's important to them. An example of this type of question might be something like, I'd like to finish off by asking you to think about what messages you'd like to give healthcare professionals, or is there anything else you'd like to mention that we haven't talked about? At all times, questions must be kept open. Think about the difference between the answer you'd get if you asked someone, how did you feel when you were diagnosed, compared to, were you upset when you were diagnosed? In addition, make sure that the questions are not leading your participant to give you the kind of answer you're looking for. For example, saying to a participant, so I'm guessing you didn't really receive good care in hospital, tells them what you think and indicates that you think that one answer is probably preferable over another. Whatever kind of interview you do, several core principles really should be stuck to. So make sure that your participant is giving you informed consent. That is, make sure the participant knows what they have agreed to in terms of being interviewed by you. This means that they know how long the interview might be and what general topics you might cover. Make sure your participant is familiar with the process of being interviewed. For example, make sure that they know that you'll be listening rather than talking, that you value their opinions and views, and that there are no right and wrong answers. Finally, make sure your participant has had the opportunity to ask questions before you begin. This is really super important. So moving on to focus groups. A common misconception around focus groups is that they are just an efficient way of getting more data. This is absolutely not the case. And a focus group is definitely not always appropriate. So focus groups originated in the field of market research, and they've been used since the 1980s as a credible social sciences data collection method. A researcher will intentionally select a group of people to come together to talk about a specific topic, and the richness of the data relies on that interaction of the group, which needs to be sensitively facilitated by the researcher, who is themselves guided by a clear focus group interview schedule. So focus groups can be used to uncover training or educational needs, or develop items for questionnaires, for example. They could be used to gather data in in-depth accounts of a particular experience, or to explore attitudes to, say, a new policy or an intervention. However, think about how this interactive process of gathering data from a group is different to interview data. The dynamics of the group encourage reflection, disagreement, challenge, and in some cases silence. Who is in the group really matters. pre-existing groups are not always a sensible idea. For example, imagine being asked to talk about your work-life balance in front of a boss you don't like. You really need to think about whether or not your topic is awkward or too sensitive and would be better suited to an individual interview. For example, what would it be like to be asked to talk about a negative body image in front of people you don't know? Of course, sometimes a group is really great for helping participants to feel safe in sharing experiences, but don't assume it will be, and make sure that you plan accordingly. There are, of course, even more options around data collection for the enthusiastic and confident qualitative researcher, some of which have really come into their own during this pandemic. So diary studies, cultural probes, walking interviews, digital ethnography, story completion tasks, content analysis of online activity. These are all increasingly commonplace and are often used in different academic disciplines such as human-computer interaction. These sorts of approaches can be great for involving people who might not be able or who might not want to take part in more traditional forms of qualitative research. And as always, just make sure that you have a strong rationale for using these methods and make sure that they fit your participants' needs and wishes, and also that they answer your research question appropriately. So just as we consider the importance of thinking about who's in your sample and who's doing the recruitment, we also need to think about factors related to data collection, which will help to support the rigour, quality and ethics of your study. First of all, who's collecting your data? Might their stethoscope or seniority make a difference? Are you collecting data in an ecologically valid way, or are you creating a false environment? For example, what might be the difference between inviting someone to take part in an interview at a university building versus meeting them in a cafe or even in their own home? Are other people present who might influence the type and amount of information your participants are willing to provide? What might all these things mean for the richness and type of data you then collect? Think about how you might be accidentally facilitating a certain type of response from your participants. Once again, I invite you to come back to your research question. What methods might you use to collect data to best answer your research question? Are interviews, focus groups or observations going to be suitable? And if not, why not? Are you reluctant to use a more novel form of data collection? And if so, why is that the case? What resources do you have and how might you use them? Okay, so we're going to very briefly in this section consider data analysis. As you might have guessed by now, the process of analysis is determined by methodology. For example, are you collecting all your data and then analysing it, or are you starting the analytic process immediately following the first interview and using this to inform your data collection? The scope of this kind of variation in analytical processes is pretty much beyond the remit of this presentation, I'm afraid. So this section is just to make you aware of some of the kind of foundational principles underpinning all qualitative data analysis approaches. So we've already acknowledged that the way in which you approach your data analysis is governed by your methodology and its philosophical framework. Your analysis will also be governed by what you're analysing it for. So, for example, if your data is pragmatic and focuses on, say, the barriers and facilitators to using an online booking system in primary care, you might want to keep your analysis quite descriptive so that key messages can just be easily drawn out and applied. You might use a simple form of thematic analysis for this. Alternatively, your research might be exploring and explaining experiences which require more interpretation and theoretical framing. Either way, you're always going to be going back and forth, looking for patterns, developing an overarching narrative through the synthesis of small chunks of text called codes into more abstract explanatory ideas called themes. There are key similarities in data analysis which are common to all these methodologies, and these involve these pattern seeking, exploration of deviant or contrasting data, synthesis, the development of an explanatory narrative, and explicit consideration of the researcher's position or reflexivity. In addition, analysis occurs across all methodologies, is a deeply immersive, iterative and time-consuming process in which the data is repeatedly returned to as interpretation develops. Some of you might have noticed the badge that I'm wearing, which says themes do not emerge. We see this all the time in qualitative research, and most of us are guilty of using it at one time or another of saying this. So think back to my earlier slide with the archaeologist and the pickaxe. Your themes are not hiding in your data waiting to be discovered. They will not emerge from the fog of analysis like glorious warriors riding to the rescue of your research question. Even with simple qualitative description, we are still constructing our analysis by interpreting our data. We develop our themes rather than waiting for them just to pop out or to rise to the surface. Nonetheless, that doesn't mean that we can just interpret our data in any old way. For example, if we were to show our data set to other researchers, we would expect them to broadly recognise the same key themes and messages. Nonetheless, the way in which we report and describe this will be fairly unique and determined by the research question. And in a moment, we'll look at how we can make sure we do this in a way that's rigorous. Just to add also that various tools do exist to support you in analysis, from the humble post-it notes and highlighters to software such as In Vivo. However, please note that these tools simply facilitate data management. They do not conduct the analysis for you. So once again, think about what bias you might introduce at the analysis stage. What and who you analyse the data for? Does the person conducting the analysis have experience of what you're researching, and does this actually matter? It's important to discuss your analysis with others, not to check that you've done your coding correctly, but to check your assumptions and to make sure that you're not missing something which might just be really obvious to you, but really quite novel, to others. The process of double coding, as it's called, usually involves another researcher analysing a portion of your transcripts before discussion and subsequent analysis of further data. And another but far more contested method of checking is known as respondent validation, where you give your participants the opportunity to agree or disagree with your interpretation of the data set. Do they feel that data is a credible representation of them and the people like them? But what if they don't? What if they deny saying certain things to you? How would you resolve this? And crucially, how does this fit with the idea that discovering the correct interpretation is not actually an aim of qualitative research? So in this last part of the session, we're going to look at how we might go about appraising qualitative research that has already been written up, and we'll also revisit your research question one final time. When you're reading qualitative research, it's important to consider the extent to which you think the authors have addressed some key factors. Over the past 40 minutes or so, we've looked at the potential for bias and plain error in sampling, recruitment, data collection and analysis, but how transparent have the authors been about this? Have the authors offered a clear rationale for their chosen methodology? And knowing what you do now, do you believe that methodology was appropriate? And if so, have they followed that methodology appropriately? To what extent do you believe the findings to be an accurate and fair representation of the population from which the sample was drawn? And also, to what degree do the authors reflect on their own position in the research process? And to what degree are the results actually useful? Can the results be transferred to other contexts and settings? And if not, why not? Just as for quantitative research, we do have checklists for the appraisal of qualitative research, but it's important to acknowledge that these are commonly perceived as being really quite reductive in nature, and crucially, they're not recipe books which kind of guarantee the elimination of bias. Although checklists such as this CASP tool can be very, very useful scaffolds, remember to think qualitatively when reading and appraising qualitative research. Consider the extent to which the paper you're reading answers a clear research question, and how much does it address the ideas of methodological consistency, information power, richness of sampling, usefulness of findings, and evidence of researcher reflexivity that goes beyond just being a box-ticking exercise. So let's go back to your research question just one last time. This session has actually scaffolded the development of a preliminary protocol for a qualitative study, not just a research question. This will include a clearly defined question, methodology, some ideas around who is and who isn't in your sample, and how you might go about recruiting them. You might even have an idea about how you could collect some data and what that data might look like. I'd be really interested to know how your study design might have changed since the start of the session. And I'd like to know if you've identified unexpected hurdles or perhaps even some unexpected resources. Also, has the way in which you think about qualitative research and the idea of qualitative research as evidence changed? And if so, in what way? Just to finish off, I'm going to offer some reflections on the relationship between qualitative research and PPI work. Hopefully at this point, you might be starting to see the potential in combining qualitative inquiry and PPI while recognising they are really quite very different things. As academics, we know that working with the PPI group improves our research at all stages. However, we also know that although the value and importance of both qualitative research and PPI for answering complex research is widely recognised, there's often real confusion between the two, particularly when we use terms like user feedback. This confusion can lead to a really unhelpful and potentially quite problematic blurring of boundaries and roles. And we know that differentiating qualitative research from PPI has been identified as a core way of overcoming potential ethical issues. This table, which is adapted from a really thoughtful paper exploring how we might combine the two approaches, summarises some of the key similarities and crucial differences between PPI and qualitative work. For example, both PPI and qualitative research are committed to gaining a deep understanding of a particular problem, but they do so in really different ways. While PPI groups and qualitative research might include representatives of the target population, qualitative researchers might seek out a broad range of views from people who are naive to the study and who don't necessarily require training or payment to take part. Both PPI groups and qualitative researchers can collect a range of types of data from a range of locations, but qualitative data collection always requires ethical approval and will always take place in a place suitable for the participant rather than an academic setting, for example. PPI contributors might be involved repeatedly at all stages of the research, from prioritising research topics and helping write proposals to secure funding, to interpreting qualitative data, doing the optimisation of an intervention. But in contrast, qualitative research often involves a single instance of data collection. Finally, the people involved in both PPI groups and qualitative research are likely to be self-selecting to an extent, but in the case of qualitative research, we're likely to seek out people who might not necessarily have ever taken part in research before, but who we think are likely to be able to help us answer our research question. The take-home point here is that neither PPI or qualitative research are a substitute for the other. They bring unique benefits to the research process, particularly in my field of research, in which the iterative development and optimisation of digital health interventions relies really heavily on the input of our research participants and our PPI reps. In my current work, for example, exploring the potential of text messages to support medication adherence for people with type 2 diabetes, our PPI group has been involved in developing the study protocol, developing the intervention objectives, developing draft intervention materials, interpreting key messages from the research, and supporting our impact strategy, amongst many, many other things. Our PPI group have not collected the data, and their contribution has not substituted the application of theory and evidence in informing intervention development. However, they have held us completely accountable and kept us efficient and focused on the target user. So in conclusion, I hope I've been able to show you that qualitative research is indeed about so much more than just chatting with random people and collecting anecdotes. It's incredibly valuable in the context of healthcare and brings us unique insight into people's lived experiences, which can be used directly to improve care. However, qualitative approaches are also epistemologically challenging and methodologically diverse. Qualitative research is committed to ensuring rigour and avoiding bias, just in ways that are really different to those promoted by quantitative approaches. And finally, qualitative research and PPI complement each other so very well, but they contribute very different things to the research process and shouldn't be used as a substitute for the other. I'd like to thank some of my fantastic colleagues for their help in putting this presentation together. And if you're interested in learning even more, come and join us on the Centre for Evidence-Based Medicine's Qualitative Research Methods course. I very much hope that you found this session useful. So please feel free to drop me an email if you've got any further questions. Thanks very much.
Nikki, thank you so much for that fascinating sort of introduction to qualitative research. It was absolutely brilliant. Thank you. If you've just got a few minutes for questions, if you've got any voice left, and we'll be happy to just take a few.
Yes, no problem.
We had one actually asking about how to ensure that PPI activity is kept separate from qualitative research, and I think you covered that really beautifully in that that last little section. But somebody has also asked, and I don't know if you're able to give any views on this, on how to find a qualitative way of measuring the impact of PPI in a study. What measures you may be able to use to do that?
That's really interesting. So the paper that I referred to here on this slide, I would absolutely encourage you to look at this paper by Morgan. There's also another paper that I'll happily send a link to, if you like, by I think it's Muller and colleagues, regarding the use of PPI alongside, for example, an approach called the person-based approach. And what's interesting about that is that they talk in particular about how difficult it is to differentiate the impact of PPI from qualitative research in particular, and that we haven't really yet developed, as far as I'm familiar with, kind of robust standardized tools, if you like. I think that's a little bit also perhaps outside the remit of this talk, because that's very much a quantitative evaluation in many ways of how you would determine the impact of something like that. I think what's an alternative way is to think about what is it you're trying to look at the impact on? Are we looking at quality of the study? Are we looking at people's experiences of taking part? And depending on what it is that you want to measure the impact on, or to explore the impact of, that will determine how you do that. So it's either standardized quantitative measure you would use, or you'd actually just use qualitative methods to ask people about that. So I think going back to what I said from the very start around what is your research question, the tools for doing that are limited in terms of quantified approaches, but the ideas around it are definitely quite active. I think people are really keen to know more about how PPI can be measured and documented in that way, but I think it's kind of different for each research question, if you see what I mean, because each study will be slightly different in terms of what it is you want to know, what PPI influenced, if you see what I mean.
Lovely, thank you, thank you. Difficult question, but thank you, that's really helpful. Just to change topic a little bit, somebody has asked, can you say where would action research sit in this? So the idea of getting topics from relevant people or groups, or what they think is important before deciding the topic of the research.
That's super important. So and that's a great question, because I think that's I think of action research being very much like participatory design. So I come from, as I said, a human-computer interaction background, which is very much about co-design participatory approaches. And that's, to an extent, it sort of bridges the gap between PPI and qualitative, but it also massively blurs the boundary, because to an extent, what action research is this process of doing the research with the same people along the way. And there are different ways, of course, in which you can employ action research approaches. So I like very much this idea of using qualitative approaches to just talk to people in your target population around what are the research questions you want us to address, what matters to you. And that's something that we do routinely and should be done routinely as a qualitative approach. It doesn't have to be labelled as action research. That's very important to talk to your target population from the very outset, to make sure you're meeting clearly defined required goals, if you like, and actually addressing something that's useful. There are complexities around participatory approaches, because to an extent you then involve people who are neither participants and then neither PPI, they're kind of both. And you need to be quite clear about what role they play in the research. So, for example, in some of my previous work, I did co-design and participatory kind of action research, I suppose, with groups of people that I then would bring new people into. I would sort of swap people in and out as I went on, so that we didn't just have the same mindset going through the whole project. We didn't have the same group of people who were perhaps sort of over familiar with the project. So it's a really important thing to do, but it's an important thing to be very aware of the pros and cons of.
Brilliant, thank you. This is an interesting one, and I'm sure it has a huge answer. Somebody's asked, when and where do qualitative and quantitative research help each other, and in brackets, if at all?
Oh my God, that's my favourite question. Thank you very much. So if I'd had another, I don't know, 4 hours, I could have given you, really, my job is, I particularly work, I'm embedded with the clinical trials unit, as quantitative as it gets. So we pride ourselves in our department, and also I think it's increasingly common, actually, not so much just unique to us, to use qualitative and quantitative in parallel. So as I mentioned, we can use certain approaches in qualitative to generate ideas which can then be tested empirically, and that's great. It's a fantastic way to use qualitative research, where you explore something that isn't really very well known. You come up with an idea of a way in which you could perhaps, I don't know, there's a really good paper around looking at people, I think it's rehab for COPD, and through asking doing lots of interviews and doing lots of questioning, they were able to categorise and kind of tentatively hypothesise people who would engage and people who wouldn't. And so they then tested that quantitatively to check that out and see if you could actually have a predictive value by using qualitative research in determining who was going to engage with rehab. So they have a kind of a really happy partnership when it comes to progressing ideas along, and particularly when it comes to clinical trials. So the work that I'm doing, I'll try and keep this quick. The work that I'm doing is in developing a text messaging system for people with type 2 diabetes to help them not just support their medication adherence, but also support lifestyle and just general health management. All of the work, 70% of the work has been qualitative to develop and iteratively test this system. And we've used that alongside psychological measures of people's beliefs about their self-efficacy, people's beliefs around what the role of medication is. And all of that together has helped us to draw out a really good picture of who is going to be using our system and how they might use it. And then we're about to start the main trial now. And that's taken a process of 4 years, but they work brilliantly together. They don't ever keep them separate, unless you know, of course you can, but they work brilliantly together.
Lovely, thank you. Probably just got time for maybe one or two more questions, if you can manage that. Just had a question about how would you support participants after an interview, or how would you manage any concerns that are raised in interviews that you do with people?
That's a great question. Yes, so I think interviews are funny things. You know, you can be having an interview about something that's really quite mundane, but it raises something that's unexpected, let alone if you're actually researching and talking about a very sensitive topic. So there's always got to be, as part of your planning process, what would you do if? So when it comes to conducting qualitative research as researchers, we need to make sure that we are debriefing afterwards and that we're also safe. So there's one side of it in terms of looking after ourselves as professionals. But just as importantly, when it comes to looking after your participants, it's important to have, for example, it's important to be able to direct people to where they need to go if it does raise something that's very uncomfortable for them, and to not just walk away from a situation. I think that, of course, we're not responsible for our participants' responses and feelings, but it's ethically questionable that it would be okay to leave a participant distressed after an interview without having put some thought into how you might deal with that. So it's certainly not about rescuing your participants, but it's absolutely about making sure you provided them with appropriate resources afterwards.
Lovely, thank you. Let's just squeeze one more question in. Do you have any views, comments or thoughts about using interpreters in qualitative interviews? Fantastic question.
So this is such a hot topic at the moment, particularly with regard to the pandemic. It's been a hot topic for a long time, but I think the pandemic has really raised its profile in that we're needing quite urgently to do work with particular groups that are perhaps more vulnerable, say, to COVID, who may not necessarily be native English speakers. And so in the work that I'm doing, we're looking at how do we make our text messaging tool appropriate for the South Asian community, who we know have a particular risk profile when it comes to type 2 diabetes. So the use of interpreters, on the one hand, is a really, really good thing to do, because approaching a community on their terms is a really important part of engaging with the community. So just because your participant can't speak your language doesn't mean that they shouldn't take part in your research. However, there are massive caveats around the fact that you need to be very clear about who is doing the interpreting and whether they are a researcher, are they a community member, does this matter? There's an issue of translation, there's an issue of backwards and forwards translation, making sure that the work that you're doing follows what you would want it to look like if you were doing the asking the questions, and that it isn't just going off on a tangent. So there's all sorts of complications around using interpreters, but fundamentally it's a good thing to do. It's a really good thing to do, but it is a bit like herding cats. It's quite difficult because you fundamentally lose control over the situation. So it's about how do you manage that situation so that you get good data, and also so that your participants are happy at the end of the interaction.
Thank you. Nikki, it's been a brilliant session. Thank you so much for being so generous with your time and for being so informative. I wish we could all give you a huge round of applause for everything you've informed us about today. To everyone who's watched, thank you very much for joining us. We'd love your feedback. There's a note in the chat with our email address and also a link to the survey, so please do send us your thoughts. And we hope that you'll be able to join us for our next webinar, which will be on the 3rd of December, and that's about finding, reading and understanding a research paper. But for now, thanks very much. Bye bye.